Canada has lost its measles elimination status after nearly 3 decades. In a statement released just moments ago, Canada's Public Health Agency says that due to the sustained transmission of the same measles virus strain for over a year, the country's measles-free status has been revoked. Canada is currently experiencing a massive measles outbreak spanning multiple provinces and even territories beginning since last October. The statement went on to say that while transmission has slowed as of late, the outbreak is still persisting, especially in under-vaccinated communities. Canada can regain its measles-free status once the strain tied to the current outbreak has been eliminated. Let's get to some clarity on all of this with infectious diseases specialist at Toronto General Hospital, Dr. Isaac Bogosh. Thanks so much for jumping on the call so quickly, Dr. Bogosh.
Oh, my pleasure. Happy to chat.
Well, I wish it was better news. So I think let's begin with some clarification. What does this mean that we have lost our measles-free status?
Well, about 30 years ago, we demonstrated that we did not have local cases of measles. We did not have measles transmission within the country because our public health infrastructure and outreach was so significant that we were able to vaccinate the general community such that when we saw imported cases of measles, we wouldn't see sustained chains of transmission within the country. Having said that, you fast forward 30 years, we have lower vaccine rates and really specifically pockets within the country that have pretty low vaccine rates. And sadly, when the virus is introduced into those pockets, you get large outbreaks. We saw that in southwestern Ontario and in parts of Alberta, 2,400 cases in southwestern Ontario, 1,900 cases in Alberta because of under-vaccinated communities. And this is the most transmissible virus we know of. It's going to ultimately find non-immune individuals, and that's exactly what happened.
Dr. Bogosh, let me ask you, not only as an expert in this field, but as a physician that cares for people, as a person in this country, I mean, there has to be some degree of disappointment with this. Well, how are you feeling?
Absolutely. I mean, Canada should be a leader, a global leader in public health. And let's not pretend for a second that we don't have an excellent public health network. We do. We have strong federal public health. We have strong provincial and municipal public health programs. I think this is a significant sign that we need to double down our efforts. We have to appropriately fund public health so that they can continue to do the hard work and important work that they do. And one of those is ensuring timely and easy and low barrier access to routine childhood immunizations. That's a significant interaction between the public health network plus the clinical network as well. But this is a team sport, for lack of a better word. And, I think having Canada lose our measles elimination status is a wake-up call. Mm-hmm. I mean, we need to do better. And hopefully this stimulates more funding, better programs, lower barriers to vaccination, sound public health communication, such that when people are faced with the decision, hey, here's a vaccine for my children or for my family, they make a smart decision.
Dr. Bogosh, this is as a result of the same strain of the measles being current throughout the country in multiple provinces and in the territories since October of last year. What went wrong? Just remind us, how did this happen?
So remember, prior to this, we would see occasional cases of measles in Canada. Those were typically imported from overseas. And we would see a couple of, either no transmission or maybe a few chains of transmission within the country. What happened here was the virus was introduced into pockets within the country where the vaccine rates were significantly lower than what is necessary to prevent outbreaks. And when the virus is introduced into those communities, it transmits like wildfire. And that's what happened. What's unfortunate is there are pockets within Canada that are under-vaccinated. I mean, the vast majority of people are immune to measles in Canada. Either they were born before a certain time and they had the infection and recovered from it, or they were provided with routine childhood immunizations. But there are communities, there are geographic regions within the country where that's not the case, and where if the virus is introduced into those communities, it will continue to transmit until sadly it burns itself out and the majority of people have been infected and recovered. We obviously don't want that. And that requires significant outreach from local public health teams to work with the community, regain trust, lower barriers to vaccines, ensure that people have timely access to primary care, taking all the steps to ensure that routine childhood immunizations are widespread so we don't see outbreaks like this in the future.
How much did misinformation play as a factor in all of this?
It's definitely a factor. I can't look you in the eye and tell you with a straight face what proportion of a factor it is, but it's definitely a factor. When we've seen this play out in multiple areas of health, not just with measles or routine childhood immunizations, but we see it play out in other areas of healthcare and public health as well. That's a difficult issue to contend with. The reason being is, there's misinformation, but there's also disinformation, well-funded, coordinated efforts to subvert public health, medicine, and science, and it has real-world negative complications, which we're seeing right now. We can't ignore that. It's not the only factor, but it is a major factor.
Dr. Bogosh, I know you have to run. Can I just get a couple more questions in, one of which being, in practical terms, does the losing of this status have any real terms results in terms of losing money or funding? Does it change our status within the World Health Organization? Like, what are the consequences of this?
So none of the sort, but there's two big ones. Number one, reputational. We are and should be a global leader in public health, health security, and healthcare, and this bruises our reputation. And number two, it's a giant wake-up call that we have gaps in our public health infrastructure and that we need to fill those gaps, and we need to do so urgently.
Okay, Dr. Isaac Bogosh, thanks so much for jumping on the call so quickly. Thank you for your time.
My pleasure, Natasha. Have a great day.
You too.